Hello, hello.
Hi, Andy.
How are you?
Good. How are you? Come on
Good.
in.
A little cold.
Welcome to New York City.
I know. I love it. So, are you ready for your 73 questions?
Yep, I sure am.
You're one of the last few on this interview series. Can you believe it?
Oh, that's awesome. You mean for 2023?
Well, more like until residency.
Oh, that's great.
As I start.
Okay,
So,
amazing.
it's quite an honor. Well, let's get started. What is your name?
My name is Payal.
And your specialty?
I am an allergist immunologist.
And how many years have you been practicing?
So I've been out of fellowship since 2008, so almost 15 years.
Right.
Mm-hmm.
So, where did you go to undergrad?
University of Michigan.
And residency?
Michigan State University. Wait, sorry. Where'd you go to undergrad and then?
And then medical school. Yeah, it's a stepwise thing.
Oh,
Medical
okay.
school.
Sorry. Okay, yeah. I went to medical school at Michigan State University, College of Human Medicine.
Okay. And now residency.
And residency I did at Rush University Medical Center in Chicago.
And fellowship.
At SUNY Downstate in New York, in Brooklyn.
Gotcha. So, did you take any gap years before going to medical school?
So I didn't take any gap years before going to med school, but I did take a sabbatical after my fellowship in allergy immunology. So I spent 2 years living abroad, and I did some volunteer work in Liberia, Nepal, and India. And then I also backpacked through Southeast Asia for about 12 weeks.
That's awesome.
Yeah.
I'm sure you got some incredible stories from those experiences.
Yeah, it was definitely a life-changing experience, something that I'll never forget, and something that I absolutely loved.
Of course. Well, I know it's been a little bit, but can you remember what was your favorite part of medical school?
I think it was all of the people that I met, including my colleagues, like my fellow medical students, and all of the teachers and doctors that were mentors throughout the experience.
And what specialty did you think you were going to go into on your first day of medical school?
So I was thinking about psychiatry at one point. Then I thought about pediatric hematology oncology. And then I landed on allergy immunology.
What changed your mind about those specialties?
So basically, I realized that I am an empath. And what does that mean? It just means that I really hold on to other people's pain, I think. And I think it's really important for everyone to understand themselves when they're trying to figure out what field of medicine they want to practice. Because I think a lot of times people just want to do the thing that they feel helps the most patients. But sometimes that might not be good for you, and there might be a lot of death and dying, and if that doesn't work for your personality type, I think that's what leads to burnout.
Yeah, I'm the exact same way, so I completely understand that. Mm-hmm. Were there any specialties you immediately out the gate said, not for me?
Emergency medicine.
Yeah. There's a lot of those extremes, as you mentioned, in emergency medicine. So, circling back to what you are practicing today, what first made you fall in love with immunology and allergy medicine?
So I basically fell in love with it because I actually suffer from a lot of allergies and asthma, so allergies of my eyes and nose, from environmental allergies, no food allergies, but asthma, and then also eczema, which are like kind of the bread and butter of what we see as allergists. And then also my mom actually suffered from all of those conditions too. So I kind of just grew up surrounded by allergic conditions.
Gotcha. And for the bright pre-meds and medical students watching that are maybe wanting to be in your shoes one day, how many years after medical school does it take to get to where you are?
Yeah, so after medical school, you have to do a residency in either internal medicine, pediatrics, or you can do internal medicine and pediatrics, which is called med-peds, which is what I did. And so internal medicine is 3 years, peds is 3 years, and med-peds is 4 years. And then after that, you do a 2 to 3 year fellowship in allergy immunology.
Gotcha. Did you consider getting any other degrees like an MBA or an MPH at all?
I did consider MPH for a brief second, but then I kind of just wanted to get done with everything. And then I feel like the MBA is more of like a recent kind of cool thing to have behind your belt, but it wasn't really a thing when I was going to med school.
Sure. So what would you say is the most unique part of your specialty?
So I would say the most unique part is that I actually get to see both adult and pediatric patients, which is really cool. And I really see probably 50-50 of both sets of patients, which I love because I love actually just seeing like full from birth until death, like that full spectrum of age group.
Sure. All right, now this is the part where I let the physician sell their specialty. So why should someone go into allergy or immunology? That's a mouthful. I'm going to have to shorten that at one point in this.
Yeah, so I mean, I think that being an allergist immunologist is super cool. As I mentioned, you get to see all age groups. No matter if you do internal medicine training or pediatric training, at the end you will end up basically seeing all age groups unless you're in an academic practice where you end up focusing on pediatric or adult allergy immunology, but that's not as common. And then I also love it because we literally treat the whole body. So we see skin conditions, we see lung conditions, we see conditions of the eyes and nose, the GI system because we see something called eosinophilic esophagitis, food allergies. So we really treat the whole body, which I think is really cool. And it keeps, I just think it keeps the day interesting and we're not focused on any one particular part of the body.
Absolutely. Never get bored.
Yeah.
So flip it around. Why should someone not choose your specialty?
So I would say that some people, so like I said, I suffer from allergies and allergic conditions and asthma. And so I really understand how it can affect your quality of life. And I think for people, like I said, who really want to do these kind of game-changing life or death kind of situations, and that's what they thrive off of and that's what they want from their medical degree, that's not what you're really going to see with an allergy immunology career as much on a day-to-day basis. There definitely are a lot of patients who have severe asthma and you are changing their life by treating them and also just the quality of life issue with allergic conditions. If you don't have them, if you don't understand them, you don't get how much of a big difference you're making in people's lives. And I think over time, for people who don't have allergic conditions, they can feel like it's just not, they're just not making a difference. And I know that I'm making a difference because I suffer from all those conditions and I know how much it helps to get the right treatment.
That is very well said and a very good perspective. Wow. All right. Fun question. Are there any stereotypes about your specialty?
I would say one of the biggest stereotypes is that we have a cush lifestyle and we make a lot of money. I would say, yes, we have, we're an outpatient specialty, so maybe we're more cush than other specialties, but unfortunately, we're not making as much money as we used to.
Okay.
Yeah.
Well, I was going to say or ask if the stereotypes are true, but,
yeah.
Hit or miss. Now, another fun one, with any stage of medical training from a third-year med student to the second-year resident, there's this concept of on-the-spot testing of random medical knowledge called pimping. So what is the craziest question you've ever been asked by an attending?
Ooh, I would say maybe something associated with the Krebs cycle or, one of those pathways that you are never going to ever use again in your life.
It's always something super deep in the back of the textbook.
Yes.
So, all right. Now we got a few kind of quick fire questions about, the day in the life lifestyle stuff. So what does an average day look like for you?
So actually I am mostly doing telemedicine. So I kind of have a little bit of a different average day, but I think for most allergists, they're going into the office, seeing patients, doing a lot of testing. So we do skin prick testing. We also do oral food challenges to see if people truly are allergic to foods or not. So that's mostly what we are doing all day.
Okay. So how many patients do you normally see in a day?
I normally see about, in a regular 8-hour day, I would see maybe about 16 patients.
Okay. And I guess I know you're the exception. You're doing mostly telemedicine. I have a question in here is your job mostly inpatient or outpatient? So for kind of an average allergist, immunologist. Are they inpatient or outpatient more?
So it's actually mostly outpatient. And, there's some allergists that practice in academic settings, some allergists that practice in community settings. And so, but both are mostly outpatient, yeah.
Okay. What's the most amount of patients you've seen in a day?
That's when I was working up in the Bronx, and I was just doing a mini half-day clinic every Friday, and I was seeing almost 30 patients just in a half day. Yeah.
Oh, in a half day. Gosh,
Yeah.
that's rough.
Yeah.
So, do you get to do any procedures?
Yeah, so we get to do the skin prick testing. We get to do patch testing, which is to look at contact dermatitis, different allergens. We also do, as I said, the allergy immunotherapy, and then the oral food challenges.
Yeah. What's the most common diagnoses or problems you see patients for?
So the most common would be allergies of the eyes and nose, so springtime allergies, fall, perennial pet allergies, asthma, hives is a big one, food allergies are a big one, immune deficiencies are also another one. So as I said, and then of course asthma, if I didn't mention that.
Yep. And so I'm really excited to hear your response to this question because I know you are a leader on this topic. So any emerging tech or advancements that you find exciting or promising in your field?
So, as you mentioned, I started a telemedicine company during the pandemic, and I owe that to my son who was in my belly at that time. I think that telemedicine is really changing the way that we see patients. I think that there's so many use case scenarios for it. I think that we're helping people that have not just one job, but sometimes people are carrying 2 to 3 jobs in their day just to make ends meet. And they just don't have time to see doctors in their normal setting. And it's really easier for them to see a doctor in their car, in their bed, on their way anywhere. And I just really love that we're able to provide that kind of care to patients and that kind of convenience, because I think it's not only good for the patients, but it's also good for quality of life for physicians too.
Absolutely. Let technology work for us.
Mm-hmm.
So what is one thing people must understand about your field?
Something that people must understand is that we're really detectives. So a lot of patients come to us because they've been to multiple doctors. So, they've been to every single doctor and no one's been able to figure it out. And then finally someone's like, why don't you go and see the allergist? So we're really the detectives of medicine, and anything that's obscure is always called an allergy, and we always have to figure it out. So a lot of history taking, a lot of kind of thinking about things and trying to figure out what's going on.
It sounds a lot like Room 2.
Yeah, yep.
Where it's like, you have no idea what it is. All right, send them over here.
Yeah.
They'll figure it out.
Exactly.
So, now, what is the toughest part of your job?
The toughest part of my job is is really making sure that patients understand what's going on with their condition, making sure that patients are able to kind of share decision making, that we're able to figure out a plan that's going to work for them. I would say that that's one of the things that I think is so important in medicine that we oftentimes overlook, and I just focus on that. So I would say that that's the toughest part, because I just want to make sure that my patients really get what they're supposed to do so that they feel better.
Gotcha. On the flip side, what's the most rewarding part of your job?
The most rewarding part, again, I think, is seeing all the different age groups, being able to really make a difference in someone's life when they're suffering with something. Like when you have a cold every single day, you just don't understand how bad that feels, and I do. So just being able to help somebody just be able to have a more functional life, it feels really good. And to help people with asthma especially is important, because my mom actually died from an asthma attack, and so just being able to help patients that suffer from that condition is really rewarding for me.
Gotcha. Well, you're helping to care for the next generations.
Yeah.
So wonderful.
Absolutely.
All right. Now I got some kind of number questions for your day. How many hours do you work in an average week?
I would say 35.
Okay. What time do you normally wake up?
6 o'clock.
What time do you normally kind of clock out from work?
From work, I would say around 3:30.
Okay. How many hours of sleep are you typically working on?
I am usually sleeping about 5 to 7 hours.
How many hours of sleep are you working on right now?
Probably around 5.
Yeah, the lower limit of that.
Yeah.
So, do you have to take call?
Well, technically, because I run my own practice, I am always on call to a certain degree. But as an allergist, you don't, if it's an emergency, they need to go to the emergency room. So there's not too many things that people are calling you for, which is nice.
That is nice.
Yeah.
So, any opportunity for further subspecializing, even in this?
So you can do a research fellowship, which just, makes you a super researcher. I don't think that there's any other kind of extra additives that you can do with an allergy as an allergist.
So, important question. How long does it take for you to chart at the end of your day?
So I am a firm believer in trying to chart as I go. And so that might mean that I'm on the computer while I'm seeing somebody, but I really think that it's important to document efficiently, effectively for the patient to make sure everything's accurate. And then also for myself, just so I'm not charting for the rest of my life.
Yeah.
Yeah.
So, who are you most thankful for on your care team?
I would say it's my nurse, Leslie. She's a virtual nurse that I hired during the pandemic. She's in the Philippines, and she's absolutely phenomenal, amazing, and indispensable. Yeah.
Lovely. And what's the most common medical advice you give to your patients?
The most common medical advice that I give to my patients is how to use their medications appropriately. Sometimes patients have all the right tools, they have all the right medications. It's really just how to use them. That's the hard part.
Okay. All right, so we've talked a lot about your life clinically. Now, how about your life when you clock out completely? So what is your favorite thing to do when you're not working?
Spending time with my son, Phoenix J.
Does your family ever ask you for random medical advice?
Yes, all the time. I actually, at one point, I was writing it down, and every single day a friend, family member, acquaintance will reach out via text, phone call, physically come and find me to ask me a question. So I think it's almost every day for most physicians.
What's the weirdest question a family friend has ever asked you?
Ooh, that's a tough one. Can I give, what do you call it? Can I give a cough drop to my infant? No, because it's a choking hazard.
That's the correct answer.
Yeah.
No, any pets?
I do not have any pets, no.
Favorite animal, not a dog or cat?
Elephants.
Ooh, great choice.
Yeah.
So if you could have dinner with anyone in history, who would it be?
Woo, I would say probably Martin Luther King.
And what would you guys be eating?
Ooh, probably, I don't even know. I'm a vegetarian. I'm assuming he was not. And so I think that we would be eating somewhere cozy, maybe Italian, maybe grits. I don't know.
Favorite dish to eat?
Favorite dish to eat would be, I would say, truffle. Anything with truffles.
Good choice.
Yeah.
Any favorite restaurants around here?
Yes, there is a really beautiful restaurant called Evelina. They just have amazing food. I haven't found a great Indian restaurant around here, to be honest with you,
Really?
but I do love Indian food too.
That's so surprising.
Yeah.
All right, coffee, tea, or soda?
Tea, chai, actually.
Good choice. Now you got to point me to all the good chai spots.
Yeah.
So how much water should you be drinking every day?
I think they say that you're supposed to drink 8 ounces every hour or something, but I am so bad at drinking water. Dermatologists definitely know the answer to that question right off the bat, but yeah.
I don't think the dermatologist I interviewed did. So
Oh, okay.
who knows?
Wow.
What's your favorite music album?
My favorite music album. So I am really awful at this. I would say maybe maybe Madonna from the 90s. I don't even know. That's what I grew up on. Yeah.
What's your favorite song at the moment?
My favorite song at the moment is Blue Moon.
Also a good choice.
Yeah.
So, pineapple on pizza, yes or no?
Yes. definitely.
Any artistic hobbies you keep up with?
I actually love to do like graphic design. So I'll make like all of my friends invitations for their birthday parties, or I just love to make, do graphic design and make
awesome.
flyers for things.
Very useful skill to
Yeah.
have. So, favorite movie or TV show?
Favorite movie is the movie with Julia Roberts. Oh my God, I'm blanking on the name. Do you know? You probably are way too young to even remember. Anyway, I can't think of the name right now, but it was a good one where she met this like guy, they fell in love. So love stories. I like romance movies.
Gotcha.
Yeah.
So, what is one random task you wish you could be better at?
Just keeping up with emails. I am really bad at that. I miss emails all the time, really important emails. So if you ever want to get in touch with me, text me.
I'm right there with you.
Yeah.
So, what's the best way that you relax after a long day?
I would say just cuddling up with my son. That's my favorite thing to do, making a puzzle with him, doing whatever he wants me to do, playing with cars, whatever he wants to do. I love doing that.
Love it. Night in or go out in the town kind of person?
Both. I actually, if it's with my son, I love spending time at home. If it's with my girlfriends, I love going out too.
There you go.
Yeah.
Indoors or outdoors?
I am also a both. I mean, there's lots of stuff I love doing indoors. There's lots of stuff I love doing outdoors. So I would say I'm very much a Libra too. So I have a hard time, I'm very indecisive, and I'm kind of a balanced girl. So I like everything in balance.
Oh, then you're not going to like this next one. Beach or mountains?
No, that one's easy. Beach.
Oh,
I do
okay,
like
there we go.
beaches. I do like beaches.
Would you consider yourself an introvert or an extrovert?
Extrovert, for sure.
Was that personality trait a factor in you choosing your specialty?
I don't know if that made a big factor in choosing my specialty, although I think surgical specialties, you can be more of an introvert, or maybe more people are introverts, because we technically need to talk to people a lot, because as I said, we're the detectives, so we need to figure stuff out.
Usually I thought it would be the reverse way. The extroverts are the surgeons.
Oh,
or at least
really?
stereotypically.
I don't think so. I don't know.
Maybe it's just my
Interesting.
school.
Yeah.
All right, so we're getting close to the end, but
Okay.
of course this is where we get the reflective wrap-up questions. So you ready?
Okay. Yep.
All right, first one. What did you think you were going to be when you grew up as a kid?
I thought I was going to be a teacher. I thought I was going to be a social worker, and I was also thinking maybe a doctor. So those were the three things I was toying around with.
Is there a different specialty you think you could have done?
Maybe derm, actually.
There's some similarities within there, actually.
Yeah.
See it. Now, if you didn't do medicine, what do you think you'd be doing right now?
If I didn't do medicine and if I was talented enough, I would either be a dancer or a photographer.
All the arts.
Yeah.
All the fine arts.
Yeah.
So everyone knows that the path to being a doctor is not easy at all. So, were there any times that you doubted you would make it as a doctor?
I think a couple of exams in med school kind of shattered me when I didn't do so well. But at the end of the day, I feel like I had enough support with like friends and colleagues and mentors that I never felt that I wasn't going to make it.
Support is a big key in the entire process.
Yeah.
So, if you could change one thing about the medical field right now, what would it be?
If I could change one thing about the medical field, it would be insurance. We fight with insurance all the time for procedure coverage, for medication coverage, and it just makes me so anxious. I just want to be able to treat patients, and I want them to not feel stressed out about how much the visit's going to cost, how much the medication's going to cost, or if they're even able to get it. So I really wish we could do something about that in our country.
Absolutely. Now, what can a medical student do right now to prepare to go into your specialty?
I think with any specialty, you just want a mentor. You want to find a mentor. You want to see what a day-to-day experience is really like. You want to do a rotation, maybe even more than one rotation, and really get a feel for it and make sure that it's what you want to do.
Well said. Now, if you were to go back, would you change any of the experiences that got you to where you are right now?
No, actually, I honestly would not. I feel like my life has been very lucky, very fulfilling, and I just feel overall really lucky with everything that's going on in the world right now. I think we should all just savor the things that we have and not really look back and regret experiences that maybe could have been better.
That has been a sentiment mirrored by many of the physicians I've interviewed. And so now we made it. Finally, question 73. What would you say to the aspiring allergist immunologist right now?
I would say you can do it. It's a great field. It is, like I said, it's just awesome that you get to see all the different age groups, and I find it really fun and fulfilling. And if you ever want a mentor or need a mentor, I'm always here.
Alrighty. Well, that's all I have for you, Dr. Gupta. Thank you so much for your
Thank you.
time.
Thank you.
And I hope your stories are able to inspire some future allergist immunologists out there.
I hope so too.